Another interesting aspect of the book is its coverage of the pre-diagnostic period. What is the significance of this period and what are its implications for counseling?
Well, one of the things we try to do in the book is we try to say that when you're looking at an illness, especially most life-threatening illnesses now, last for a long period. They may last for years. And we often talk about the crisis of diagnosis, what we might call the diagnostic period, what we might call the chronic period as people struggle with treatment. Not everyone dies of a life-threatening illness. In many ways, people recover, and that has its own issues. And then certainly there's the terminal phase. And I build my work on the work of people like Avery Weissman, who talked in these terms, and E. Mansell Patterson. But I think one of the innovative things here is that it really calls attention to what I call the pre-diagnostic period. And the pre-diagnostic period is a period when a person, it can be a lot of different kinds of contexts, but the most common is when a person has a symptom of some kind. And and it's that time between the first appearance of the symptom and then the seeking medical help. And often you learn a great deal about the person in that time. You learn about their coping, you learn about their belief systems, you learn about their anxieties. I'll give you two examples of this. In one case, for example, there was a mother who whose son, a teenage son, adolescent son, about 12 years old, was constantly complaining about leg pain. And she was kind of dismissive and saying, it's just growing pains. Don't worry about it. Take a Tylenol and you'll be fine. And eventually the complaints became such that she did seek the hospital and did seek medical care. And it found out that the child really at this point in time had relatively late stage osteogenic sarcoma. Well, you can imagine the tremendous amount of guilt because for months she had, passed over this symptom. So often what I tell counselors is to really explore with the client. I often call it an unguarded, to explore with the client what happened from the minute they began to suspect that something might be wrong to when they actually sought medical confirmation. And this ties back to culture, because sometimes you may see that people may go to indigenous healers or use indigenous health practices before they go back into mainstream medicine. So it's a very important, very critical time, and it often tells you a lot about clients.